Pat's role in the organization as chairman of the board has been pivotal in a very stressful time. After Tim Stack's death, the possibility of chaos was very high, and Pat was so steady and so calm and so focused on helping make Piedmont healthcare better.
He held on to the rudder, kept everything going straight. Is probably, and if it wasn't stressful, it was because he didn't show it. It had to be stressful. It was stressful for the board. It was stressful for the system.
He's so optimistic. The glass is, I think, more than half full. It's 3/4 full. And so there's never a problem that you feel as though you can't tackle and address under Pat's leadership.
Well, my life since Pat's been chairman has been just gravy. I mean, it's been great. I mean, people actually talk to me now. They return my telephone calls. They respond to my emails. They speak to me in the hall now. So I'm loving it. Half the people probably think I'm him.
You know, when I think about Pat and all of his incredible qualities, I really admire his keen intellect, his really terrific judgment, and his very generous spirit.
Pat is an unusual combination of superior clinical physician and skilled surgeon and skilled administrator. His ability to interact with patients has carried over to his ability to interact with employees and with the bigger picture understanding of where Piedmont healthcare is headed and how it best can get there.
Acts appropriately under stress, unless it's maybe a 3-foot birdie putt that he still can't make.
If I had 3 words to describe him, obsessive compulsive disorder.
He's got a pretty big ego. He likes to be in control. He has a little thing about controlling things. But you know, I hear a lot of good leaders have these qualities. I hear Vladimir Putin has the same qualities, and that's worked out great for Russia. So I think Piedmont's going to be in great hands.
Well, I would describe his personality as a mixture of extreme competence coupled with an unflappable character who makes you feel better by being around him.
I don't think he's got a fault. I don't think he's got a lot of skeletons in his closet. That you can ask his brother. Growing up, the guy was a mess, and it's surprising he turned out the way he did.
Well, it was actually kind of sad, really. You know, Pat was a funny-looking kid. He didn't have many friends or many talents, really. I mean, I don't want to use the word superstars, but all of his siblings were pretty well known for a lot of different talents. Pat seemed to have gotten left off of that.
On a personal level, I would really count Pat as a friend, as a mentor. I've seen him firsthand as an extraordinary Piedmont physician. And for me, that means coming to Piedmont Hospital with my own family members, and just to see the level of compassionate care that Pat brings for every single Piedmont patient and everyone in our community. It's really terrific.
Well, Pat's a very intelligent person. He's good at looking at all sides of a difficult question. He's good at seeing the big picture. He's got very good judgment, unless you count some of the women he dated in medical school. I'll be happy to talk about that at some point if you'd like.
The way he cares for his wife, my mother, it's very much sets a good role model. And as a husband, he is one of the most selfless individuals I've ever seen.
I mean, when Pat was growing up, he had this kind of mousy, squeaky, very irritating voice. It kind of made your skin crawl. But I think he looked around and saw sort of how I was doing. I was very popular with all the girls, made great grades, a terrific athlete. And he said, I need to be like my older brother. And Pat was a good imitator, impersonator, and he said, I need to change my voice to be like Lewis. And since the voice change, it's been lights out ever since then. Westminster, Yale, Emory Med School, you know, head of Piedmont now coming up. That was the difference, the voice change.
Over the last couple of months, I've been thinking about how I could possibly be prepared to step into Pat's big shoes to succeed him as board chair at Piedmont Healthcare. And what I didn't fully realize is just how big the shoes are.
He's always done just a jam-up, jelly-tight job.
One of the things he really learned how to do early, though, is drive. His driving experience began around age 12 when he would lift the car keys as our parents went out and take he and his friends for joyrides around the neighborhood. So he's actually a very good driver, one of the few talents he developed as a child. So if this CEO gig doesn't work, I think Uber would be a great fallback for him.
Pat brings to the table all of the attributes that we look for in a personal leader, and he brings the understanding of the administrative side of leadership that is what makes him unique.
I would say as he leaves the board but takes on a huge management position, probably the same thing I would have told him 20 years ago or 30 years ago, that he's very important for what we do, and I've got his back, and he's been a great friend, great friend.
So the advice I'd give to Pat as he undertakes this new role is to be yourself, look at all sides of the situation, do what's best for the organization, and that you have a lot of people available to give you any advice you need and help you out.
Pat, it's been terrific working with you on the board these last several years, and I'm looking forward to continuing to work with you in your role at Piedmont Atlanta Hospital. Thanks, Pat, for everything.